Okay, so guys, this episode is going to be divided into 3 rounds. And starting with the first round, I'm going to be giving you 3 clues and you need to guess and tell me what the condition is and what its broad line of management will be. Are you guys ready?
Yes.
Yeah? Can we have some energy?
Yes.
Let's go. This is spread to humans by animals. Most commonly sheep, goats and cattle.
अरे वो ई से है
E से भी नहीं है. So you M से है नहीं, E से है नहीं और कितने अल्फाबेट्स चाहिए देखो?
वो कुत्ते वाला नहीं है
कुत्ते वाला नहीं है. Keshav is killing this round. Can we clap for him? Like seriously, Keshav killing this round. Super, very well done. Hi guys, welcome to Prep Ladder Studio and this new series called Diagnosis, where we invite toppers to answer various medical problems and test their clinical skills and ability. But before we get going, a little bit about me. I'm your host, Dr. Manan Vora. I'm an orthopedic surgeon and sports medicine specialist. Now, as fate has it, I found a way to amalgamate my love for sports and my passion for medicine, and I am now a clinical practicing sports medicine specialist. And now let's move on to our toppers and get an introduction from them. Hi Aaroush, welcome to the show. So one thing I'm going to ask you to do, as well as everyone else, is to tell us some funny incident from your MBBS journey. Go for it.
I'll need to put a great amount of thought in that because I was not that of a fun person. But yeah, I would say.
Are you trying to say toppers aren't fun?
Oh my god.
Is that a stereotype?
Not really.
Is that a stereotype? Because this is a chance for you to break it and show everyone, tell everyone in the audience that toppers can also be fun. Come on, give us a fun story right now on the spot.
Alright, so we were on a trek to Brahmtal. We were a group of like 7 or 8 guys and it was a night time. It was pitch dark, we were camping. We were 3 or 4 guys put into one camp because they put the couples individually in separate camps. We were a group. And what happened was we went out to pee. It was completely pitch dark in the night and we saw a sort of shadow of something approaching towards us. We didn't realize what it was and we were as it was approaching us, it was like we saw a sort of lamp holding it and we were like dead afraid and we screamed and then came a woman out of nowhere. And in the morning we were confronted, that was one of the person from our group and it was weird sort of, I don't know.
Okay. Great story. Awesome. Moving on to you.
Hey guys, my name is Dr. Angad. I have done my MBBS from Dhamija Medical School Foundation, Philippines. I have secured an All India rank 9 in the June FMGE exam. Speaking about myself, I am quite an extrovert person. I do love talking and I love traveling and I love doing adventures.
Awesome. One story from your MBBS journey, something that you remember, super funny, relatable, that everyone in the audience can enjoy. Go for it.
It was related to a ghost incident as well. It was just a second year and the COVID session was going on. So, and everything curfew and everything was going on. So then, it was quite of a exhaustive time to stay inside home and stuff like that. So a couple of friends and all, we decided let's go at night around 12 o'clock to the graveyard. So we were everyone has that curiosity, what's there, if there is ghost or not like that. So we all went over there and coincidentally that time, a couple had come, to, I don't know, maybe just to check the scenery or something like that. And they were very white in color.
Okay.
So a couple of friends went towards them and rest is history and we all came running. Yeah.
Okay. So clearly there's a pattern over here. If you're watching this, if you've not seen a ghost yet, go and see one because that's the way you top exams. Apparently there's a pattern going on here. Awesome. Tell me something about you, please.
Hi, my name is Dr. Darshika. I did my MBBS from the Dhamija Medical School Foundation in Philippines and I secured an All India rank of 40 in FMG exam.
Tell us something about yourself, Darshika. What do you do in your free time? What are your hobbies?
My hobbies are, I really like to work out. I am a gym freak and I love lifting weights.
That's nice. Can you tell all the students out here how they can find some time for their exercise and their fitness during their medical entrance exam preparation? How did you find time? Please tell everyone.
Actually, to be very honest, I wasn't very regular with my fitness journey, but I used to work out 3 to 4 times a week, maybe 45 minutes a day. I think you just need a yoga mat or just a corner of the room to work out, nothing much. You just have to look out for your body sometimes.
That's great. I think that's a great lesson over there, because even 3 to 4 times a week, even if it's 45 minutes a day, can play a huge role. And to everyone listening out there, you'll be surprised as to how important exercise and working out is for your mental productivity and your overall output, even when it comes to preparing for your exams. Thanks a lot. Darshika is setting a great example for everyone watching. Hi.
Hello, I am Dr. Keshav Garg. I secured All India Rank 6 in NEET-PG 2023 and I am currently pursuing medicine in Loknaik Hospital, Delhi.
Keshav, did you always want to be a doctor?
Yes.
Since what age?
From around 8th class.
8th class.
My father
Why,
is a
if I
doctor.
may ask? Your father is a doctor.
Yes,
What
sir.
specialist is he?
He's also medicine physician.
Medicine physician. Okay.
Yes,
So
sir.
why did you want to become a doctor? What is your inspiration? What part of the journey inspired you, or why do you want to be a doctor today?
I've always looked up to him. He getting praise from everyone, saving lives. That's what inspired me. to be a
Awesome.
doctor.
So it's the job satisfaction, the fact that you're getting to help people, the fact that you're actually having a chance to make people disease-free and pain-free that actually attracts you to the profession, right?
Yes, yes.
It's lovely having all of you. Welcome to Diagnosis and welcome to Prep Ladder Studio. Okay, so guys, this episode is going to be divided into 3 rounds. And starting with the first round, I'm going to be giving you 3 clues and you need to guess and tell me what the condition is and what its broad line of management will be. Are you guys ready?
Yeah.
Yes.
Yeah? Can we have some energy?
Yes.
Yes.
Let's go. Okay, so the first one, the microscopic examination of this condition shows 3 C's: Charcot-Leyden crystals, Crayola bodies, and Kirschmann's spiral.
Asthma.
Yes.
Bronchial asthma.
That's correct. So who's going to go and tell me the broad line of management for asthma?
We have the medicine.
Keshav. Keshav, first year medical resident. Go for it.
We'll mainly give bronchodilators and steroids along with it. And based on the exacerbating factor, we can add other antibiotics if needed.
That's right. Lovely. Okay, moving on to the second one. In this, we see the occurrence of number 1, a breast mouse. Number 2, the radiology shows popcorn calcification. And number 3, the FNAC is showing stag-on clusters of cells. What is the condition?
Fibroadenoma.
That's right. Well done, guys. How would you go about managing this condition?
So basically, fibroadenoma is a benign condition.
Yes.
So we find that out by taking a biopsy, and then based on the women's, first of all, on size. If it's like not a huge mass, and along with that, if the woman is fine, we go on with it like asymptomatic treatment. Or if it's actually causing some problem, we go with the surgical management.
That's right. Well done. Moving on to the third one. Your 3 clues now are: number 1, bimodal age distribution; number 2, X-ray showing Codman triangle; and number 3, histopathology slide shows malignant osteoid. What is the condition?
Osteosarcoma.
That's right. I think all of you got this one. I think Codman triangle was a giveaway in this.
Yeah.
When you hear that, that is the first thing that will come to your mind. Okay, how are we going to go about managing this?
So we first go about imaging the patient and we go about the complete evaluation. For that, we go for X-rays, CTs, and if needed, MRI also to see the extent. And then we go about planning whether the disease is malignant, spread enough that we cannot operate. Then we go about chemo and all. Otherwise, if the patient is surgically manageable, then we excise the tumor.
Absolutely spot on. Well done. You guys are doing better than I expected. Moving on to the next one. A patient is showing, and here are your 3 clues. Number 1, esophageal webs. Number 2, iron deficiency anemia. And number 3, atrophic glossitis. What is the diagnosis?
Plummer-Wilson syndrome.
That's right. It is Plummer-Wilson syndrome. How would you go about managing this?
So the ENT surgeon would go about excising the tumor, I suppose. The iron deficiency can be managed by iron tablets, or we'll go about the iron level, seeing whether the patient needs injectable irons and all. And atrophic glossitis would be reversible with the iron deficiency, though I'm not very sure. To be honest.
That's right. But yes, the main crux of this condition would rely in the iron supplementation, of course. All right, moving on to the next one. Here are your 3 clues. Number 1, multinucleated giant cells. Number 2, coffee bean nucleus. And number 3, chicken wire calcification. What is the diagnosis?
So can we know like whether it is from what part of the bone, epiphysis, diaphysis, or metaphysis?
So it's arising from the epiphysis.
Epiphysis. Okay. So then we have 2 choices.
GCT or
GCT or
chondroblastoma.
chondroblastoma. So
That's
we'll
right.
go with chondroblastoma.
You're pretty close. Yes, you got it right. It is chondroblastoma. Nice one. How would you go about managing this?
Chondroblastoma would be surgical excision. I don't know. Like, I'm not very sure, but maybe.
Yes, so surgical excision, then based on, of course, doing the entire analysis, the decision with the oncology team to decide whether chemotherapy or radiotherapy, that would be the ideal way to go about it. Nice work, guys. Moving on to the next one, the last one of this round. We see the presence of these 3 points that I'm now mentioning. Number 1, Reed-Sternberg cell. Number 2, PAX5+, PX5+, and number 3, EBV+. What condition does this patient have?
Classical
Hodgkin's lymphoma.
Absolutely, that's right. It is classical Hodgkin's lymphoma. How would you like to go about with the management?
So basically, Hodgkin's lymphoma is chemo.
ABVD regimen, yeah.
You'll go with the regimen, and basically we go with the prognosis also as well. If you diagnose it earlier, and then you distinguish which type of Hodgkin's lymphoma is to be specific, whether it is like the mixed or nodule or something like that.
That's right. Absolutely lovely. This was a great round. You guys got almost all, and then in the end you got the last one as well. Well done. Let's move on to the next round. Okay, moving on to round 2. Funnily enough, this is my least favorite part of any subject in the entire medical curriculum. So whether it was histology back in the anatomy days or pathology, I absolutely hated drawing these diagrams or identifying them in exams. So we're going to take you back a trip down memory lane to our times when we all had those HNE pencils, which we bought, and we did those diagrams. Frankly, I never did those diagrams myself. I got others to do them for me. So this is my coming out of the closet moment where I openly tell y'all that I didn't actually do those diagrams myself. But what you need to do is identify what you see in the slides that I'm going to show you, and then tell me what condition it is. Sounds good?
Yeah.
Are we ready?
Yes.
Yes? Okay, here is the first one. You can describe what you see and then how it led to the diagnosis that you have.
So this is, I think, typical flask-shaped ulcers, which is seen in Entamoeba histolytica infections.
That's right. Very well done. This is something I would have personally never got. At any stage of my medical life, if you would have asked me this question, I wouldn't have the answer. So clearly you guys are doing great. Moving on to the next one. Here you go.
Owl eye, which can be seen, and I guess this is cytomegalo because it is blue in color. So cytomegalovirus.
That's right. So this is the owl eye appearance seen in CMV pneumonia. Very well done. Moving on to the third one. What do you see here?
So these are asteroid bodies seen within multinuclear giant cells in sarcoidosis.
That's right. Very well done. Let's get to the next one. What do you see over here?
So these are probably Hurtle cells, and this is probably thyroiditis.
Got it.
Hashimoto thyroiditis.
That's right. Okay. Moving on to the next one. Here you go.
ये
कॉलेक्शनर बॉडी
वो इलास्टिक आते हैं आर्टरीज में तो ना
कॉलेक्शनर बॉडी है ना तो
वो आर्थराइटिस है ना
नहीं कॉलेक्शनर बॉडी ओवेरियन टेस्टिस वाला ट्यूमर व्हाट डू यू कॉल दैट
अरे
कॉलेक्शनर
हाँ,
बॉडी
ये
जर्मिनो नहीं ग्रैनुलोसा सेल
Endodermal
ट्यूमर ग्रैनुलोसा सेल ट्यूमर या ये एंडोडर्मल साइनस है
कॉलेक्शनर
ग्रैनुलोसा सेल है या ये वो है एंडोडर्मल साइनस है
ये ग्रैनुलोमा
कॉलेक्शनर ही लग रही है
So y'all are beating around the bush. I'm going to give you all a hint. It's a type of cancer that begins in germ cells.
हाँ जो ट्यूमर दोनों होते हैं
It's
Endodermal
but
sinus tumor.
नहीं यार
नहीं।
कॉल मैं आई
Call
रिमेंबर दिस
Exner है।
निमोनिक एज कॉल
ये क्या योक्सैक ट्यूमर है वही
That's
एंडोडर्मल
right.
साइनस ट्यूमर है ना
that's right. So these are Schiller-Duval or glomerular
Glomerular
bodies
bodies.
seen in yolk-sac tumors.
योक्सैक
Okay, you guys are getting all of these. This is really great. Let's talk about how y'all are so good at identifying these slides. How has Prep Ladder helped you in your journey? Can you tell me?
like the videos, the lecture notes, they are quite informative and like help in retaining things. So yeah, I would say.
Nice. What about you? Anything you can share about your journey with Prep Ladder?
The rapid revision notes provide set of all images of path at one place, so they're usually helpful in revising at the last moment.
All right.
Actually, I wouldn't be so confident in solving these pathology questions. So the person I looked up to was Preeti ma'am. She helped me a lot.
That's nice. Clearly, I should have met Preeti ma'am before in my life. Moving on to the last one of this segment. Here you go.
So these are all rods seen within phaget cells. So this would be acute promyelocytic leukemia, which
This is AML M3 type, yeah.
That's right.
Faggot cells.
That's lovely. That's correct. Well done, guys. You've absolutely aced this round. It's time to move on to the next segment, which is the rapid fire round. Let's get ready for it. Okay, we're here with the final segment of this round, and this is the rapid fire round. So guys, what we're going to do here is that I'm going to ask you a question. If you know the answer, you raise your hand, which is your buzzer. I point at you and you give me the answer. In case you get it wrong, it passes on to the next person who had raised their hand. Are we good to go? Okay. Starting off, the first one. Burr cells are seen in?
Uremia.
That's right. Well done, Keshav. That's right. So we've got burns, uremia, and prolonged exposure to EDTA. Okay. The next one. What is the stain used to demonstrate Howell-Jolly's bodies?
supravital stain.
No.
Crystal violet.
No.
Supravital methylene blue.
Okay, I'm going to give you a hint. This stain is used to detect parasites such as malaria within the blood. You should be getting it now.
Gene का ना?
आर्सेनिक तो होता है.
Jimsa.
नहीं. Malarial parasite stain को diagnose करता है.
No? Alright, finally guys, you all don't know something. This is the first time I'm feeling like a winner over here. But this is the Romanowski stain. Okay, moving on. A starry sky pattern on biopsy is seen in?
Burkitt's lymphoma.
That's right. Well done, Angad. The starry sky pattern refers to a monotonous background of basophilic lymphoma cells within which pale or clear tingible macrophages are present. So, nice answer. Next one. What is the most common carcinoma associated with asbestosis?
Adenocarcinoma.
That's right, but you're not raising your hand.
Okay, sorry.
No, just kidding. But you have got the answer right. It is adenocarcinoma of the lung. Moving on. The Michaelis-Gutmann bodies are the histological findings which are seen in? Yes, Keshav.
Interstitial cystitis.
No.
उसका भाई.
Cystitis. उसका भाई.
What do you call that?
उसका भाई.
Yes.
ठीक है. पूरा फैमिली हिस्ट्री भी बता देना, पूरा फैमिली ट्री बता देना, बहन कौन है, भाई कौन है, उसका बाप कौन है, वो भी बता देना, ठीक है? ओके, कौन है उसका भाई?
मामा तो वो.
Some bladder condition.
That's right. Very well done. I
cystitis.
love how you're thinking. Go for it.
Yeah, because we need only two bhai wali conditions. Na? It's interstitial cystitis. The other one is. Nah, you get. I'm gonna give some priming.
Okay, so your hint is that it's a rare inflammatory condition that typically occurs in immunocompromised individuals.
see
You know,
other
you know
bodies
it,
also.
you know it,
yeah.
you know it. I know you know
Yeah.
it. You just need to get the name.
Especially
Malakoplakia.
That's
Malakoplakia.
right. Very well done, Keshav. The answer is malakoplakia of the bladder. Very well done. Moving on to the next one. Blunted callisis, asymmetric cortical scar, and histology showing thyroidization of renal tubules are seen in?
Chronic pyelonephritis.
That's right. Keshav is killing this round. Can we clap for him? Like seriously, Keshav, killing this round. Superb. Very well done. The next one, donut granuloma, is seen in?
Cat scratch.
No.
No. It's an infection, no?
Hmm.
Okay.
Malaria.
No.
वो तो Durkman bodies होती हैं, yeah. The
Okay,
donut
hint.
bodies.
Let's go.
Yeah.
Okay. This is spread to humans by animals. Most commonly sheep, goats and cattle.
अरे वो ई से है.
E से भी नहीं है. So M से है नहीं, E से है नहीं, और कितने अल्फाबेट्स चाहिए देखो?
वो कुत्ते वाला नहीं है.
कुत्ते वाला नहीं है.
Okay.
Okay, second hint and the last one. It's caused by inhaling dust particles contaminated by infected animals.
Not that good of a hint, but okay.
Please don't know it. Please don't know it. Guys, you all have to come across as humans also. So it's okay to not know something. Okay? We're good? The answer is Q fever, which is known as?
Coxilla
Coxilla
pulmonary. Yeah.
Let's move on to the next one. CD16, CD56 and CD94 are positive in which cell?
NK cells.
NK cells. Full form, guys?
Natural.
Natural killer cells. Funny story, in post-graduation, in Vivas, if you give short forms, you're in for a tough time because seniors don't like that. So, idhar to chalega, lekin please remember as a habit when you're answering, always give the full form. So, GA sounds very basic, but the examiner wants the full form. Okay? Next one. Most common secondary infection associated with silicosis is
TB.
TB. I just said say the full form and look at this guy. Aaroush, 3 push-ups. Aja. नहीं आजा bro. ऐसे
No, I
ऐसे
haven't
नहीं
explained.
होगा.
No.
3 push-ups मार ले. हाँ? Last time, pakka. Last time you said short form. Okay, done. Okay, next one. A trinucleotide repeat seen in Huntington's disease is CAG. That's right. फिर से.
Cysteine adenine.
Yeah, but in this one I understand. This one I understand.
Don't
It's a
understand in
sequel.
GA,
Yeah,
you understand in CET.
yeah. In this one I understand. I'll give it to you. Next one. Warthin-Finkelday giant cell is characteristic of
Measles.
That's right. Keshav is right again. Well done. And with that, we come to the end of the rapid fire round. Well done, guys. Give yourselves a pat on the back. That was super fun. I enjoyed hosting it as well. I hope you guys had as much fun taking part in this. I'm pretty sure it was pretty interesting for all our listeners as well. To everyone watching, I hope you are playing along with us and trying to guess the answers as well. For more such episodes, do tune in to the Prep Ladder Studio and don't forget to hit like, share and subscribe.